those works are coming. I made some aminos. Electrolytes. This is aminos. Sorry. Look at my beautiful screensaver. I love my computer. It makes me so happy when I do schoolwork. It's got waterfalls. All of my themes are nature, of course, because that's where I thrive. I don't think I realized before I become homeless how much I need to be outside. How much I need to be in the sunlight. Sunlight makes me happy. Makes me so happy. And you know, out in the wilderness, nobody can hurt you. Literally, nobody. It's so peaceful. I'm kind of butthurt because I wanted to work out and I got in the gym and there was this guy in there, and listen, I went in there on like Monday or Tuesday and he was in there as well, and he was like, I guess he's like a personal trainer. I say that lightly because he weighs like 500 pounds. So he was training a girl on Monday or Tuesday when I went in there, and she was on the floor flopping like a fish. I am not exaggerating. She was face down in the middle, and y'all have seen this gym. It's tiny. You've seen the inside of this gym where I go and I box around with the mannequin. Y'all have seen this gym. It's tiny, right? Oh, one of my stalkers. Let me screenshot that for a lawsuit. Oh, all y'all are stalkers. Wow. Can't even fucking like, and then people wonder why the comments are cut off. Y'all don't know how to be respectful. Why would I want to talk to people who are mean? Or perverts. Oh, it's exhausting meeting the same fucking carbon copies over and over and over and over. Anyways, so this guy is in there. It was Monday or Tuesday when I went to the gym. And I get in there, and y'all have seen the inside of this place. It's tiny. It's not like a Planet Fitness. It's not like a Bailey's or an LA Fitness. It's extremely small. A couple hundred square feet, okay? Tiny. So anyways, I get into the gym on Monday, and I noticed this guy who's like I would say 350 to 500 pounds. And so I was like, oh, great. He's probably in here trying to lose weight. No, he's not. He's a personal trainer. And he had this girl face down in the middle of the gym, the middle of the floor, where one would deadlift or do snatches, which is what I was trying to do. This girl's face down, literally flopping like a fish. She had her arms behind her, and she's like flopping like a fish. And I'm like, this, Jesus Christ. I can't escape it, you know? I cannot escape it everywhere I go. Everywhere I go. It's exhausting, okay? So I'm like, all right, let me do my hip thrust, blah, 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 blah. So I sat down to do my hip thrust, and I noticed that this guy who was training this girl all of a sudden decided that he was going to sit down about 4 feet away from my crotch. This is what he was doing. So I'm like, all right, weird. Stopped doing my hip thrust. I picked up something else, came back to my hip thrust, completed my 4 sets, and I got out of there. Well, then today, I scoped out the gym to make sure nobody else was in there, okay? I pay my money to use the gym, which is $4. I go to use the gym, and all of a sudden I look up, and there's that same fucking guy. This time, however, he has what appears to be a small child, the age of maybe 8 to 12, who he's going to personally train as the father. And it's crazy because I saw this father and son duo walk into the gym, and I was like, that's weird. This is for adults, but whatever. And all of a sudden I see the father sitting in the lobby, and then I see this guy who's a personal trainer with this child about to set up a weight bench. And I told the lady that I paid, I said, I'll come back later. First of all, listen, I let somebody train me one time and they pulled something in my leg. And that was probably because they had no clue what they were doing. And I'm going to go out on a limb here and say that someone who has become morbidly obese, who does not have any physical activity themselves, probably shouldn't be training people in physical activities. Call me crazy, but that'd be like you're about to fly a plane and you take advice from a surgeon. You know what I mean? You ain't never flown a plane before, but the surgeon's going to tell you how to fly the plane. And that's all I got to say about that, folks. So now I'm waiting out these gym people, this gym person. You know what sucks is that that's the only place around this town they have to do things like that. You know, it's such a small community of people. There's literally no parks here. There's one park. It's across town, and you guys have been there with me. It consists of a playground and a little walking track. That's it. That's it. Sad. No, I mean, and everybody, I wonder if I can find a statistic. Hold on, hold that thought. I wonder what the obesity rate in Stokes County is. What's the obesity rate in Stokes County, North Carolina? It says 33%. I do not believe that. If you come out here and take a fucking gander, it'd blow your mind. You stand out if you're not obese in this county. It's that bad. It's that bad. Everywhere you go. Where did I go this morning? Hold on, let me think. Where did I go in this morning? And there was a bunch of women, and one of them helped me. Oh, the pharmacy. Yeah. So I went to Walmart's pharmacy to check out because the front lines were busy. And at the pharmacy, I noticed that every woman in there was over 250 pounds. I'm not exaggerating. I used to weigh over 200, so I know what 250 on a 5'4", 5'5" woman looks like. These women were every bit of 250 to 300 pounds each, and they worked in the pharmacy here in Madison. There was 6 or 7 of them. You go into businesses, gas stations, restaurants, and everyone is obese. They're not overweight, they're obese in this county. So I don't believe that for a minute. That number was from 2022. They lie about numbers all the time. General census, all you got to do is walk around town and pay attention. The library, every person that works in that library is over 200 pounds. It's sad. The reason that these things are happening is because there's nothing for these people to flip and do here. There's not even sidewalks for them to walk through town if they want to. It's called anti-homelessness infrastructure. Because they do not want homeless people here, they do not build accommodations for anyone. Instead of addressing the problem and fixing it, they just shove it under a rug. And in the crosshairs, the community is getting larger and larger and larger, with more people out here dying and more people having health problems every single day. They're making money off of that, of course. There's a hospital here and the Novant Health, and don't get me started. There's no sidewalks, there's no parks, there's no outdoor activities. This is the flippin' mountains. It is gorgeous. Take a gander at how pretty it is out there. And you can't even go enjoy it because there's nothing to do here. And everybody that you see is obese. Not overweight, obese. It's a huge difference. That's when they start having health problems, no mobility, depression. Speaking of depression, that's something that I want to talk about today. I want to talk about major depression disorder. Because I tell you guys that sunshine and weather and getting outside and drinking water and eating a healthy diet will help with these things. Unfortunately, major depressive disorder is one of those things that you're going to need multiple lines of treatment to fully succeed and make it through daily struggles with this disorder. Of course, exercise, diet, and sunshine will help with this disorder majorly. But I was learning about it sometime earlier in the week. Give me 1 second, because I only have like 50,000 screenshots. The reason I want to talk about this is because this is a disorder that you know how I'm always talking about the importance of mental health medication and therapy. Major depressive disorder is one of those things that you would have to have an ongoing treatment plan with medication and therapy to succeed and have the best results to recover from this depression disorder. A lot of these mental health disorders, borderline personality disorder, bipolar disorder, major depression disorder, all of these disorders are so severe that there should be multiple lanes of care at the same time. So we would want to implement medication and therapy and a treatment plan, and potentially even involve family to assist with this treatment plan. These people need assistance, and specifically from their family. They need assistance from their family. I think a lot of these mental health disorders are completely overlooked by family. If you're suffering with something like this, a lot of people go through it alone. The family is unaware that they need to be involved in helping the patient. And if you love your family, and you want the best outcome and you have their best interest at heart, I feel like you would want to be more understanding to this mental health disorder and how your actions impact it. Yeah, so I guess I'll do the gym later. It's okay. Since the heat's been so hot, my schedule has gotten a little different. So major depressive disorder, MDD, also known as clinical depression, is a serious mental health issue characterized by persistent sadness, loss of interest in activities, and significant impairment in daily functioning. And it goes beyond that. This type of depression starts to snowball. So it starts as a sadness. You become uninterested in your daily activities, your hobbies, people that you love, people that you did stuff with. All of a sudden, you don't want to socialize with them. Then you start to isolate in your home or your bedroom. Anything that you think about doing, all of a sudden, you have no interest in doing it. Say you used to love to rock climb. All of a sudden, that doesn't excite you anymore. Say you used to love to cook. All of a sudden, you have no interest in food. This snowballs into isolation. Then the patient may stop taking care of themselves. They won't shower. They're not eating on a regular basis. That makes this depression even worse, because then they feel bad about themselves, their appearance on the outside, the lack of hygienic care that they've been given to themselves. And so that makes them isolate even more. Once again, this is a snowball thing. All of these things like go in circles. The cycle of like self-abuse from the depression goes in circles, right? For people that live out of cars, that suffer from this disorder, and a traumatic event can send someone into major depressive disorder. And it actually stems, a lot of people that have this, it stems from childhood trauma. And we'll get into that in a minute. But let's say that you were kicked out of your home and then you had to move into a car, and there's no restrooms out here in the middle of the night. And this is a real scenario. I've seen girls and guys on TikTok and YouTube that live out of their car, and they showcase that they keep a jug to urinate in. If you have major depressive disorder and you're doing that, you're not going to stay on top of being tidy, taking care of your laundry, cleaning your body, and then you're going to start to smell. If you're storing things like that in your car, everything in your car will start to smell, and then that snowballs into another cycle of isolation And that can cause a lot of problems for homeless people if they become homeless and they're suffering from some sort of depression. And you'll see these people in the community, and they often do stink. They often do look crazy. They often act crazy. They've literally lost their minds, and they're in such a depression. And a lot of these people also have PTSD from trauma. It's a dangerous cycle. It goes beyond, in my opinion, just feeling sadness. I love that that's how Google describes it. You know, they're leftist. You would think that they would have more empathy and break this down a little better. It goes farther than simply being sad. This impacts your mental health on a level that you simply cannot take care of yourself. You cannot take care of others, and you cannot commit to taking care of your daily task in life, and your mind and your body completely shut down. And it's impossible to pull yourself out of this state of depression. This is a really sad place for people to be in, and there's so many people in this place, even that are not homeless, but we see this a lot in people that do become homeless, because the impact of living on the street and or in a... Have I told you lately that I want to jump off a bridge? Here, hold my bag while I jump off a bridge. You know, I wonder how many years I'm going to have to do this before I can, like, have an actual studio. I just know my studio is going to be nice. It's crazy. I'm going to have to put a fan on you. It's so hot outside that the phone is Apple when it gets hot. I try so hard. I be wanting to cry. It makes me so frustrated. So these people that have major depressive disorder, it's more than simply being sad. So MDD is believed to be caused by a combination of biological and genetic factors, also environmental and psychosocial factors. Some potential include family history of depression, traumatic or stressful life events, certain medical conditions, substance abuse, and women are diagnosed with depression more than men, but men also experience depression, sometimes with less obvious symptoms. So it literally says MDD is treatable with the right support and treatment. Most people can recover. The issue is most people that have things like this, the other people in their social circles do not take these mental health illnesses for real, and they're not coached on how to deal with these mental health issues. And for the best possible result, we would want the patient to have a support group that helps them through these times. And also holds them accountable. You know, if you're living at home with mom and daddy, and mom and daddy know that you have major depressive disorder, mom and daddy can do their due diligence to come in and get you out of bed and put sunshine in your face and motivate you to get up and take action. Because as you're going to see in a minute, that's what you need. That's what you need. Sunshine. Sunshine. Lots of it. You need to bask in it. So this is also called clinical depression. This is what, I guess, what's the word? Psychiatrist, clinician would call it, is clinical depression, major depressive disorder. And it completely impairs daily life. God, I forgot I even read that. So apparently people that have major depressive disorder, clinical depression, their life expectancy is 10 to 25 years less than what a normal person without MDD would be, which is really sad. I mean, if it knocks off 10 to 25 years off of their life because they're suffering from clinical depression, That tells you how much, not only of a psychological toll that it takes on your body, but a physical toll, because these people end up having 10 to 25 years less years on this earth from the depression. Yes, major depressive disorder can be considered a disability under the Americans with Disability Act and for Social Security disability benefits. However, there's different levels to this. There's different levels to autism. There's a spectrum. Not everybody that has clinical depression would qualify for disability. So most people, if diagnosed, their mood is depressed. They'll also have a decreased interest in pleasurable activities, feeling of guilt or worthlessness, lack of energy, poor concentration, appetite changes, psychomotor retardation or agitation, sleep disturbances, or suicidal thoughts. So there's different stages to clinical depression. It can lead to a range of emotional and physical problems. It can decrease a person's ability to function at work or home. So the types of depression: stage 1 would be a change in the emotional state. Stage 2, physical symptoms or behavioral changes. Stage 3, increased severity of symptoms. And stage 4 is thoughts of self-harm or suicide. So the DSM-5 requires the presence of a major depressive episode for at least 2 weeks. So this would be someone, hypothetically, for 2 weeks, they've been completely isolated to the basement. They're not eating on a regular schedule. Probably haven't showered for a week. They're probably in a loop of television shows, Netflix, or maybe they're eating too much. Maybe they're ordering DoorDash 2-3 times a day and doing nothing but watching Law and Order as they just sit there and eat. Uber Eats. The appetite changes could be eating too much and could be not eating at all. So anyways, the DSM-5 requires the presence of a major depressive episode for at least 2 weeks. A major depressive episode is characterized by several depressed moods or loss of interest, pleasure, accompanied by at least 4 additional symptoms from a specific list, such as changes in sleep, appetite, energy, concentration, or self-image. That's another thing. When we see people who have made an honest effort for years to wake up every morning and put time and effort into their hygiene and the way that they carry themselves, they do their makeup, they do their hair, they put on a presentable outfit, and then all of a sudden they gain 80 pounds, their hair's falling out, they're not wearing makeup, their skin's pale because they ain't seen the sun since Jesus was a boy. Those are clear signs to go from a switch like that. That is a clear sign of clinical depression. You know, people don't put in time and effort for 30 years and then all of a sudden wake up one day and just decide that they're not going to give a shit about how they look anymore. The symptoms must cause clinically significant distress or impairment in social, occupational, or other important areas of function and cannot be attributed to any other medical condition. So for instance, let's say that you are a school teacher and all of a sudden one day you wake up and you can't get out of bed and you're calling into work and then you're laid off. That's how clinical depression could get you fired or laid off or you quit. It's affecting your job to the point that now you don't have a job. Also, it says impairment in social. So let's say that all of a sudden you wake up and you want to divorce your husband of 30 years and you can't seem to pull yourself out the living room and out the bonbon box. That's not normal. You know, the clinical depression would affect your relationship with your children, your husband or your wife. It would impact your social relationships to a point that you're isolating away from people. You're running away from them and you're giving them excuses and you're not showing up like you used to show up for people. This is a severe mental health disorder, and a lot of these people that end up with clinical depression, some of them occasionally end up with things such as agoraphobia, where they've isolated so long and they haven't been properly diagnosed with clinical depression that now they have a whole new psychological issue where they're actually and factually scared of society to the point that they never leave the home. That's what agoraphobia is, and I had an aunt that suffered with that, and I do believe that clinical depression was closely related to why she developed that phobia, because she was never properly diagnosed with either one. So she was terrified of the outside world, would not go to the grocery store, would not drive, would not see people. If the mailman knocked on the door, she wasn't answering it. It's sad. My family was notorious for not seeking out mental health services. They always, that it was a stigma, and I think that it still is. A lot of people are ashamed of the fact that they may suffer with anxiety or depression and stuff like that, and you should not be ashamed. We have all, first of all, in my opinion, it ain't even our faults. It's in the food, it's in the way that we were raised, it's in the way that we were brought up, it's environmental reasons why a lot of us have these problems. Sure, genetics can play a role, and we're going to get into that with clinical depression, but in my opinion, it ain't even half of our faults. How do we have control over how our parents raised us? That's why I talk about these things, though, because there is a solution to these problems, and if we talk about them, we can figure it out together. Call me. If you can't figure it out, call me back. Cat Williams, remember that? Hilarious. So let's see here. Symptoms. At least 5 of the following symptoms must be present during the same 2-week period, representing a change from previous functioning. Depressed mood. This can be reported by the individual feeling sad, empty, hopeless, or observed by others appearing tearful. In children and adolescents, this may present in irritable moods. Diminished interest or pleasure, loss of interest or pleasure in activities that were previously enjoyable, significant weight loss or weight gain. We typically see weight gain, but I'm the opposite. I talk about this all the time. When I'm under stress, when I'm depressed, I can't eat. I have the opposite problem. A lot of people stress eat. They eat their emotions. Loss of interest in, a change of more than 5% of body weight in a month, or a decrease or increase in appetite. Insomnia or hyperinsomnia. So this is difficulty sleeping or sleeping too much. So this psychomotor agitation or retardation. This is observable by others, not just subjective feelings of restlessness or slowness, fatigue or loss of energy, feeling tired or lacking energy nearly every day, feeling worthless or excessive guilt, including delusional guilt. So some of these patients feel guilty about stuff that's not even their fault. Diminished ability to think or concentrate, difficulty thinking, concentrating or making decisions, and reoccurrent thoughts of death, including suicidal ideation, plans, or attempts. These symptoms must represent a change from previous functioning and must cause clinically significant distress or impairment in social, occupational, or other areas of function. Exclusion of other conditions. These symptoms must not be better explained by another medical condition, substance use, or another mental disorder, such as schizophrenia or bipolar disorder, to qualify as major depressive disorder. So this is from the DSM-5. This is how the doctors I'm sorry, y'all, my brain today. This is how the doctors would diagnose a patient with major depressive disorder. The DSM-5 also includes specifiers to further describe the depression, such as atypical features, anxious distress, or psychotic features. If the symptoms of depression are present for a longer duration, at least 2 years in adults, and meet the other criteria, it may be diagnosed as persistent depressive disorder. Damn. Let's talk about how to treat it. And how many people have this? Hold on 1 second. I know I go off on side quests. I can't help it. How many people in the USA has MDD? represents about 8.3% of the population. I do think that these mental health conditions are overdiagnosed nowadays, but I do also think at the same time we have a lot of people out here psychologically struggling. I'm one of them, honey. I just went through a bout of depression for the past 3 days. I don't even want to talk about it. One of them days I didn't even shower. If I'm being honest, like, I don't think that I have major depressive disorder, but I do think that my other mental health disorders, such as CPTSD and my PMDD, I do think that when things impact me emotionally and psychologically, it throws me into a state of depression, and it is probably from my CPTSD, because that's a trigger. Being hurt, emotionally is a trigger. So, I mean, for most people. But for my CPMDD specifically, and it throws me into a small state of depression where I'm just kind of like, what is life? Why am I here? You really feel like it's hell on earth sometimes. So let's talk about how to treat it, because clearly a lot of people, the prevalence is much higher among women, and in my opinion that's probably because, no offense, but women are more emotional creatures as opposed to men. Men are more rational, logical, I don't know what the word is, methodical. They're just more leveled out. Women, we run on emotion. It's just who we are. We're emotional creatures, and in my opinion, this is probably why there's the prevalence among women are higher, with 10.3% of females affected to only 6.2% of men. I think that men are taught to be strong. They're taught to hide their emotion. Mental health problems, what's that? We don't have those. And it's kind of sad, because men are overlooked when it comes to mental health problems, in my opinion. It's just, men need a safe space too. They deserve to be heard too. So men are not going to report these mental health problems as much as women, so that's some explanation for why the men's number is, almost 4% lower than women's, because there's a stigma behind men admitting that they're struggling, because society puts so much on them to be strong, and they are, they absolutely are, but you know what I mean. So let's talk about how to treat. How is depression treated? Clinical depression, medication, and I said this a while ago. We would want to see medication in unison with therapy. I personally, I'm not a clinical, but if I were, I would not be prescribing medication without A, active therapy, and B, a treatment plan. We see so many people nowadays getting prescribed medication without either one of those last two things intact. It's like every 6 months they're changing medication. And I don't think people realize that, humans are being used as guinea pigs. They have been. I was one of those children. I think that the medication started when I was somewhere between 4 and 6. And so it's not good. It's not good. These people are not getting proper treatment when they're not receiving the therapy and the treatment plan, in my opinion. So medication, antidepressants, which is SSRIs, we've talked a little bit about those. I still don't know how I completely feel about those, because I was on those as a small child as well. But they're called selective serotonin reuptake inhibitors. And this type of antidepressant increases the serotonin levels in the brain. You know what else increases serotonin levels in the brain? Exercise, a better diet, getting outside, being in sunshine. I'm not saying that people don't need these drugs. And matter of fact, clinical depression is something that they absolutely might need these kind of drugs. So I'm just saying that I feel like therapists and clinicians should be telling people, sure, we're going to give you medicine. We have a treatment plan. But also, we need you to do this side quest and get outside and go hike a mountain, or get outside and go to the park, but they don't do that. They want patients fully reliant on them for help. And, I've talked about this before. I've known people that had to get back surgeries when they simply needed to stretch. It's crazy. So antidepressants work by affecting the brain chemicals know that it takes 4 to 8 weeks for these medications to have full effect. Well, isn't that funny? Because we've talked about these drugs in the past and how quickly they put children on them and switch children to a different medication in less than 4 to 8 weeks. But this article says that it takes 4 to 8 weeks for some of these antidepressants work. So what is the point of giving a child an antidepressant or an adult for 2 weeks and then switching it to a different one when we in fact know that it could take 2 months for this medication to work properly? These medical professionals, in my opinion, they do not give the patients enough time to see if the medication even works. So it says it takes 4 to 8 weeks for the medication to have full effect. And every medication is going to be different. Some medications, it can take 6 months to see the full effect. Keep taking the medication, even if it doesn't seem to be working at first. Never stop taking your medication or change your dose without first talking to your healthcare provider. That's another red flag we need to talk about, because a lot of these healthcare providers, they are not properly informing patients of the long-term side effects of these medications. And some of these medications have long-term side effects when trying to come off of them. Hold on one second. Yes, so when coming off of SSRIs, you may experience withdrawal symptoms known as the SSRI discontinuation syndrome. Common symptoms include flu-like reactions and physical symptoms. This can cause headaches, gastrointestinal issues, distress, faintness, and symptoms may start within a few hours to days after stopping the medication. Anxiety, irritability, mood swings are also common. Cold sweats, nausea, vomiting, constipation. They go through absolute hell. And most of these patients, in my opinion, are not even informed by their provider when they are prescribed medication of the withdrawal symptoms. That is very concerning for me. And also, that's medical malpractice, in my opinion. Symptoms can last for a few days to several weeks, depending on the individual and the medication's half-life. It's important to consult with a healthcare provider before stopping an SSRI, and they can help to manage withdrawal symptoms effectively. Some people are going to need these medications. A lot of people don't need them. That's not for me to decide. That's for a clinician or a clinical to decide. But I just want to be clear that this is why I have a problem with Big Pharma and medical providers, because I've had so many friends of mine and family and children. I've dated people that had children that were on some of these drugs, and it was concerning how often they switch these drugs for a 14, 15, 16-year-old child. And I myself was a victim of Big Pharma, and I was a guinea pig for the state. And I just want to talk about these things and be clear. This is nothing to be ashamed about as far as having clinical depression. And I think that people should get in contact with help if they feel like they have clinical depression. But also I want people to know the dangers of Big Pharma and these mental health services. You cannot cold turkey these medications. It can cause you a lot of psychological and physical problems if you just decide to stop taking these medications. So never do that. Some people have to switch to medicines or add medications to get the proper results. Work closely with your healthcare provider to find a treatment that works for you. So medicine would be the first plan of action when it comes to treating clinical depression. And then therapy is the most often cognitive behavioral or interpersonal therapy. It focuses on changing the distorted views you have of yourself and your situation. It also works to improve relationships and identify and manage stressors in your life. This is also a great way for someone to help you work through your treatment plan. If you have family that is not trying to help you, your therapist will. And they will also hold you accountable. When you're sitting there saying, oh, my life is so bad, everything's falling apart, I'm a piece of shit, nobody loves me, your therapist is going to be in your ear saying, oh, no, that's not true, you got a great husband, girl, you got 2 kids that love you, you have every reason to live. So this is why therapy is important, but they'll also hold you accountable, like I said, and they'll keep you on track. But that part is often skipped nowadays. Medications are given without therapy and a plan. So another, and I don't know how I feel about this. We might have to look this up because I don't know what this is, if I'm being honest. This is some kind of a electroconvulsive therapy. It's ECT. Let's see what this is. Electroconvulsive therapy is a procedure that uses a mild electrical current to cause a brief seizure. I don't know how we make it so far and then we take so many steps back. I'm sorry, do what? It is used to treat severe mental health conditions, including depression and schizophrenia. The ECT is done under general anesthesia and has been shown to help people who don't respond to medication or talk therapy. Listen, I don't know how I feel about this. I feel like that's stretching the boundaries of something. It produces an electrical currents to cause a brief seizure in the brain. So, you know, you want to hear something crazy? Cleveland Clinic back in May of this year is promoting this sort of therapy now. Listen, I will have to do some search on this and some research to see what the flip this is. But, call me crazy. My first initial thought is how crazy is it that we're sending electrical currents through the brain to cause a damn seizure when we know that seizures can cause deaths? I just think sometimes medical professionals are out here playing God a little too much. Like, you'll be asleep and won't feel it. Look, they're trying to sell me on it. They're trying to get me to come get a fucking lobotomy. I'm sorry. A flipping lobotomy. I'm sorry. They're trying to sell me on it. So this is through Cleveland Clinic. Find a doctor, locations and directions, patients and visitors. They're trying to sell me a lobotomy. An ECT. You'll be asleep. You won't feel any pain or discomfort. I'm sure that's what they told the people that they gave lobotomies to, too. This treatment effectively treats severe mental health conditions, including depression, schizophrenia, and more. It's safe, low risk. Electrical convulsion therapy is a procedure that uses a small electrical stimulus to cause a brief, controlled seizure. Are you for real right now? Listen, I am not down with this. I'm not down with none of this. This sounds like torture. It's a medical treatment for mental health conditions that don't respond well to medications or other treatments. All I heard was, you're too damaged to fix, be our guinea pig. It involves applying electrical currents into the brain in a controlled seizure. You sure about that? You sure about that? It is the most effective treatment for for clinical depression. Hold the phone. What is the best treatment for severe depression?
According to AAFP, second-generation antidepressants, including selective serotonin.
You ain't no help. So that did not come up. This hospital, that's the Cleveland Clinic, that's trying to sell me this seizure. They said that this is the most effective treatment. However, when I look into it, it says that medication and therapy are the designed best treatment. So these people need to be in jail for lying and trying to sell me a procedure that might leave me, I don't know, severely retarded. Call me crazy, but I don't think we I think that maybe you should just go stand in a thunderstorm and see if you get hit by lightning. I mean, it's the same effect. It's crazy. So it says that the conditions that they can treat with this shock shit is bipolar disorder, catatonia, major depressive disorder, mania, schizoaffective disorder, schizophrenia. In my opinion, they just gonna mess you up even more. Oh wow, they do this to pregnant and breastfeeding women. You may be a candidate if you have a serious mental health condition and are pregnant or breastfeeding, didn't respond well to antidepressants or other medication, have symptoms that prevent you from eating or completing your daily routine. Mine's from stress, but still. The current, using electrodes, a small electrical current will trigger the seizure. It usually lasts 60 to 30 to 60 seconds. ECT isn't a one-time treatment. Instead, it's a course of treatments. You may need it 2 or 3 times a week. The total number of treatments depends on your condition and how ECT is done and how well you respond. The risk, the common side effects of ECT include headache, muscle aches, nausea, and blood pressure being risen. Rare or serious side effects include memory loss, heart rhythm problems, and death. How did we end up here? No, absolutely not. Do not recommend. 0 out of 50 stars, 0. I don't know about that, homie. I don't know about that. Yeah, so we would want to see medication and therapy. Because that's the alternative. And listen. So let's talk about why people end up with major depressive disorder, clinical depression. There's a multitude of reasons. Everybody that has it has different reasons how they got it. And clearly, with 21 million Americans having it, God, that puts things in perspective for me. It really does. So, depression, also known as major depressive disorder, is a mental health condition. Let's see here. Genetic factors. Family history of depression suggests the genetic component, with researchers estimating that genetics contribute to around 40 to 50% of the causes of major depressive disorder. So, like, let's say your great-grandfather was super depressive and he took his own life. He was a raging alcoholic that took his own life. His depression could genetically be passed to me. It might skip a generation, like blue eyes or red hair, and it might fall on me. Or maybe my mother was depressed, my grandmother, you know. Maybe one of them had a disorder, like bipolar disorder, and so there's a family history of it. It says that 40 to 50% of the cases are genetic. So if you know that you have a family member that was depressed and then you hit your 30s and all of a sudden you become depressed, you're going to have to work twice as hard. I guess it's a good thing that maybe you have like some genetic factors so that you can pick up on it sooner, but you'll just have to work harder at diet, exercise, medication, therapy, and do your due diligence. I guess actually having genetic factors and a family history of it might help you out. So also brain chemistry can cause clinical depression. Imbalances in neurotransmitters like serotonin, dopamine, and norepinephrine, which plays a crucial role in mood regulation, sleep, appetite, are thought to contribute to depression. So a lot of people don't produce or release the levels of dopamine, serotonin, and all of these happy chemicals in the brain, and that causes MDD. But also, things to help to produce dopamine, serotonin, and the happy chemicals in the brain is to eat a healthier diet. Most of our, what was it, like 40-50% of our, I think it's dopamine, is actually created in the gut. So the healthier and more whole food diet that you eat, the better results at producing that dopamine that is going to go to the brain to make you happy. If you're eating nothing but processed crap, your body can't even function like it's supposed to be functioning, and it's also not getting the aminos, the macros, the healthy fats, what it needs to produce these chemicals for the brain. And so diet plays a huge part, in my opinion, in depression, and diet can help with depression. Hormonal changes, particularly during reproductive years, pregnancy or menopause, and those related to stress, and the hypothalamic pituitary adrenal axis, it can also affect mood and contribute to depression. The neuroendocrine disruptions, the HPA axis, which regulates stress responses, may be dysregulated in individuals with depression, potentially leading to elevated cortisol levels, and that's your stress chemical. Inflammation in the brain and body can also play a huge role in depression, with chronic stressors and prolonged inflammatory responses potentially contributing to the development. Neuropathology, depression can be linked to changes in the brain structure and function, including reduced neuroplasticity, impaired neurocircuitry, and decreased production of neurons in the hippocampus. But there are also indeed biological factors that can contribute to your depression. In my opinion, unhealed trauma can lead, in my experience, unhealed trauma can lead to depression. Things that you haven't dealt with, things that you haven't addressed psychologically, things that maybe have happened to you, things that you went through, things that you witnessed. In my opinion, not dealing with those things and getting to a certain age, maybe your 30s, and seeing things a little bit different than you did in your 20s, it can bring on a bout of depression. There are indeed biological factors that can contribute to your depression, but there are several other potential causes too. There may be things in your past that you don't even associate with your symptoms. One major factor that can contribute to depression is experiencing childhood trauma. Several studies have revealed a strong link between childhood trauma and depression. Of course, if you experience childhood trauma, that doesn't necessarily mean that you'll develop adult depression. However, because trauma and depression are so closely linked, experts agree that you may be at a higher risk if you experience trauma. Whether or not you remember your childhood trauma, or if you've chosen to block it out of your mind, your body still remembers. To truly heal, you must partner with a qualified medical health professional to discover the root causes of your depression. While working with your clinician, you may uncover some causes of depression from childhood trauma. Childhood trauma comes in many different forms. There may be events in your past that you've shrugged off as unfortunate, when in reality they were traumatic. Some examples include witnessing or experiencing domestic violence, sudden or violent loss of a loved one, physical assault, sexual assault, neglect, psychological abuse, physical abuse, bullying, serious accidents, life-threatening illnesses, and community violence. And also, I just want to say that screaming and yelling and installing fear into a child, studies have shown that actually changes the child's development, their brain chemistry. It stunts their growth psychologically. So that is a form of abuse, because it impacts their mental health, their frontal cortex. So even something as simple as getting berated, put down. Your parents used to say, oh, I wish I would have never had you, or oh, I should kill you, I brought you in this world, I should take you out. And it was a daily reoccurring thing where you were getting shouted at, cussed at, belittled. That's abuse. Unfortunately, Unfortunately, childhood trauma is more common than you may think. According to the Substance Abuse and Mental Health Services Administration, over 2/3 of children report at least one traumatic event by the time they turn 16. The link between childhood trauma and depression is complex, but the bottom line is, although it's not a certainty if you experience trauma that you're, but the bottom line is although it's not a certainty if you experience childhood trauma, you're more likely to develop depression later in life. So biologically, childhood trauma has been linked to changes in stress hormone systems that impact your body's ability to handle stress. Biological changes like this can contribute to your risk of developing depression. Cognitively, experiencing trauma in your childhood could play a part in your developing negative cognitive patterns such as guilt, self-blame, and feeling worthless, such as profound cognitive changes can contribute to your depression. That also explains why people turn to drugs, in my opinion, why substance abuse becomes a problem in a lot of these people's lives. Socially, childhood trauma and depression are also linked because if you experience trauma, you may have trouble forming healthy relationships or interacting with others. You may also isolate yourself, which can lead to even more depression. Experiencing trauma in your childhood may also impact your emotional regulation. The development of healthy emotional regulation skills may be interrupted due to childhood trauma. This could lead to difficulties coping with stress and challenging emotions, which turn in and may increase your risk of depression. In my opinion, this is also why we see a lot of people struggling in drug addiction. They don't know how to manage and regulate the emotions they're feeling, and they fall to drugs. I was one of those people. Coping mechanisms. If you've experienced childhood trauma, you are more at risk for developing maladaptive coping mechanisms like substance abuse. What did I just freaking say? I'm getting chill bumps. Like substance abuse to cope with the pain. These unhealthy coping skills can contribute to depression. Your childhood trauma makes a long-lasting impact on your mental health, of course. How it may manifest as an adult varies based on specific traumas and your individual characteristics. You were likely forced into survival mode if you felt unsafe, neglected, abused in your childhood. Let's talk about how childhood trauma may look as an adult. Childhood trauma makes a long-lasting impact. As a result, you may exhibit some of the following negative impacts of childhood trauma. Mental health concerns. Not only are you more likely to develop depression from childhood trauma, but you also may have an elevated risk of developing anxiety, post-traumatic stress disorder, and personality disorders. Substance abuse. In an attempt to cope with challenging emotions associated with trauma, you are more likely to turn to drugs and alcohol. Mood swings. Because childhood trauma affects emotional regulation, you may be more prone to intense mood swings and experiencing emotional numbness. Y'all notice that a lot of this stuff is like from one extreme to the other. Like either you don't eat or you're eating too much, or you don't sleep or you're sleeping too much, or you're completely numb, or you're hyper sensitive to these things. I don't know if that's the word. Ain't that crazy? It's to one extreme or the other in a lot of the symptoms. Relationship issues. As mentioned earlier, childhood trauma may negatively impact your social skills. You may experience issues and have fear of intimacy. Low self-esteem. Not only are trauma and depression closely related, but childhood trauma can also damage how you feel about yourself. You may struggle with feelings of inadequacy and self-doubt. Not only that, a lot of people that grow up that went through trauma as a child, they have a lack of identity, and they struggle with their own personal identity. In my opinion, this is why we see so many of the upcoming youth who are on this gender fluid, non-binary, I want to be a cat one day, I want to be a wolf tomorrow kick, in my opinion. Physical health problems. Unaddressed childhood trauma can manifest into physical problems like chronic pain, autoimmune disorders, and stress-related illnesses. Again, not everyone who experiences childhood trauma will exhibit these behaviors, but if you're a victim of trauma, there's a good chance you can relate to many. Depression from childhood trauma requires help and support of a qualified mental health professional with the right clinician by your side. You can heal and move forward to live more of a fulfilling life. I found this, I think it's through the National Medicine. I found this report that was related to this. These things kind of go hand in hand. I want to read just a small portion of this. It said, this was an annual research review enduring neurobiological effects of childhood abuse and neglect. I'm not seeing a date on this. Childhood maltreatment is the most important preventable cause of psychopathology, accounting for 45% of the population, attributable risk for children onset psychiatric disorders. That's saying that 45% of the population of children that have these psychological disorders, it's coming from environmental reasons. 45%. That's something that's curable. And all of this is curable. We would start with educating the parents. We would start with giving parents the tools to properly raise children. Psychology used to be taught in schools, and I'm sure it's been taken out by now because anything of use and that was actually educational has been removed from schools. This stuff needs to be taught in home ec. I don't even think they have home ec anymore. This report states that there's preventable causes, okay? Preventable causes. That means that these problems can be fixed. We can prevent more children or adults from falling into clinical depression, anxiety, drug use. We can prevent that if we focus on the family unit. I want to read some more of this. Hold on one second. This is very difficult. These medical stuffs, it's hard for me because I don't understand the words. A lot of times I have to go and like Google everything. So the findings of this study, I'm going to try to get through this. Parental verbal abuse, which is what I was just talking about, the berating, the putting your child down, yelling at them every time you tell them to do something. This was my family. There was never kind words spoken in my home. Everything was under duress, violence, and shouting. Parental verbal abuse, witnessing domestic violence, and sexual abuse appears to specifically target brain regions and pathways that process and convey the adverse experience. Maltreatment, which is abuse, is associated with reliable morphological alterations. It's got like 5 different places of the brain. I'm going to say the ones I can. The hippocampus, the cortex, the corpus callosum, how do I know where it is and I can't even say it? The amygdala. They figured out that the worst kinds of abuse that affected the brain the worst was witnessing domestic violence, parental verbal abuse, and sexual abuse. These 3 kinds of abuse in the home, it affects the dorsal lateral prefrontal, the cortex, the orbitofrontal cortex. It affects like 6 parts of the brain. So most of those parts of the brain are under development until the age of 25 to 30. The brain does not fully develop until 25 or 30. And so when these children are being subjected to abuse, it's literally rewiring their brain. It's affecting their brain. It's crazy. And And they also this study showed that it also shrunk parts of the brain, and it also enlarged other parts of the brain. Let me tell you, evidence is emerging that these regions and interconnecting pathways have sensitive exposure periods when they are most vulnerable. Early deprivation and later abuse may have opposite effects on the amygdala volume. Structural and functional abnormalities initially attributed to psychiatric illness may be more direct consequences of abuse. So this is complex. Sorry. These brain changes may be best understood as adaptive responses to facilitate survival and reproduction in the face of adversity. So the changes in the brain are coming from these kids being in fucking survival mode, bro. Parts of the brain shrink and other parts of the brain grow, which is abnormal. Thoughts about the potential effects of childhood abuse on the brain began with the idea that repeated exposure to stress could kindle the developing lymphatic system. Findings of a spike in sharp wave in These findings were similar to the clinical and EEG findings observed in individuals with temporal lobe epilepsy, provided some support, as did early findings of reduced hippocampal volume. So that the hippocampus, like I was saying, certain parts shrink. The hippocampus is one of them. Interestingly, lymphatic irritability has endured in our studies as a symptom cluster most strongly associated with exposure to childhood maltreatment. Based on preclinical studies, we went on to propose a more expansive hypothesis that abuse experiences would induce a cascade of stress effects on hormones and neurotransmitters that would affect the development of vulnerable brain regions. Okay, our alternative view is that the brain is modified by early stress in a potentially adaptive way. Briefly, we have proposed that the exposure to substantial levels of childhood maltreatment nudges the brain along alternative developmental pathways to facilitate reproduction and survival in what, based on experience, appears to be malevolent, stress-filled world. Yes, that word, malevolent. Malevolence is what causes PTSD. That's the word I've been looking for 3 weeks. Malevolence. In this case, psychopathology may emerge due to the mismatch between the world the brain was modified to survive in and the world it finds itself during subsequent developmental stages. These two hypotheses are not mutually exclusive. There may be types of exposure that trigger adaptive responses and experiences that are so egregious as to damage the brain in a non-adaptive way. It's also likely that polymorphisms that influence the expression of molecules involved in neurotransmission, stress response, or the brain development may render some individuals more susceptible to both the positive and negative impacts early experience. The hippocampus is a key limbatic structure that is critically involved in the formation and retrieval of memories. Oh, wow. Oh, fucking wow. You're kidding me. Oh, wow. That explains why I have no memory. The hippocampus contains place cells, which along with grid cells in the interconnection cortex provide an internal positioning system for the representation of places, routes, and associated experiences. Wow, the hippocampal abnormalities have been reported in several different psychiatric disorders, including post-traumatic stress disorder, major depression, schizophrenia, bipolar disorder, and borderline personality disorder. The hippocampus is the most obvious target in the brain to reflect the potential effects of childhood mistreatment. It is highly susceptible to damage from excessive levels of cortisol. So the more the stress, the higher the stress in the child, the underdeveloped of the hippocampus, and the worse their memory is going to be. It explains a lot. It explains a lot. That's crazy. I didn't, I study these things and I get, I take in bits and pieces, but sometimes when I'm with you guys, I learn a lot about myself and why I am the way I am and why my brain works the way that it does. It makes perfect sense. In a study of women with histories of sexual childhood abuse, that reported that the bilateral hippocampal volume appeared to be significantly affected by exposure at 3 to 5 years of age, to a lesser degree at 11 to 13 years of age. So the sooner that they were sexually abused, the less their brains developed. And if they were abused from between 11 to 13, it less impacted their brain. The hippocampus appears to be the most sensitive to maltreatment around 7 to 14 years of age. This observation is supported by preclinical studies showing that early separation stress has a greater effect on synaptic density in the hippocampus than prefrontal cortex, whereas adolescent stress exerts greater effects on prefrontal cortex than hippocampus. Okay, so the younger they are, the more abuse and maltreatment is going to affect the hippocampus. The older they are, the more it's going to affect their prefrontal cortex. I don't know which is worse. Oh, God. Overall, maltreatment appears to exert a predominant influence on hippocampal development, regardless of presence or absence of psychiatric disorders. Hence, maltreatment has been insidious confound in nearly all psychiatric studies. 8 different psychiatric disorders have been associated with reduced hippocampal volume. So that tells me there's a lot of abused people out here. A lot of people with a lot of trauma, as I've always said, hurt people. 8 different psychiatric disorders have been associated with a reduced hippocampal volume. So those 8 disorders that come from, it says disorders associated with a reduced hippocampus include neurodevelopmental disorders, conditions like autism spectrum disorder and ADHD can lead to hippocampal deficiencies, Alzheimer's disease, neurological disorders such as epilepsy, schizophrenia, stress-related conditions, and acute neurological conditions. Damn. So it doesn't just affect the hippocampus, it also affects the amygdala. The amygdala is another key limbic structure that is critically involved in making emotional memories. It's affected. Maltreatment or abuse affects the cerebral cortex, like the hippocampus and amygdala. It possesses a population of stress-susceptible pyramidal cells with a high density of receptors that peak during late adolescence. Oh, wow. It even ruins their gray and white matter in the brain. I mean, how do we have all of this science and this is the answers? This is the answers. How do we have all of the answers and we don't put them to use to help families and children and to stop these psychological problems? A striking observation that emerged from this intervention project was that overall 6.5 to 6.4 reduction in cortical gray and white matter volume, respectively, in orphans subject to early deprivation and who continued in institutional care. Their brains are not developing like normal children's. That's almost a 10% reduction in gray and white matter. 6.5%. Reared orphans who were randomly assigned to a high-quality foster care you sure about that? High-quality foster care system between 7 and 33 months of age showed a remarkable similar 3.4% reduction in gray matter volume. Listen, this is the second time in 2 days gray matter brain. This is the second time in 2 days. This gray matter is a crucial component of the brain and spinal cord, primarily located in the outer layers of the brain. It consists of neural cell bodies. Listen, axons, and it's responsible for processing information, controlling muscle movement, and regulating sensory perception. The gray bodies, which are involved in various cognitive functions, emotions, and motor control. Overall, gray matter plays a vital role in enabling normal brain function in daily lives. Well, what if they don't have it? What? Let's do gray matter development. Gray matter is a part of the brain that forms early in fetal development and continues to form until about 8 years old. After this, gray matter begins to decrease in the areas of the brain, but the density of the matter in particular increases. This increase in density allows for higher processing and further mental development of humans. The cortex is where we form thoughts and memories, and the amount of gray matter increased during childhood, and then it declines into adulthood. Abnormalities in gray matter, such as the delay, can indicate further neurodevelopmental impairment. Alright, I'm going to circle back to that another day. So, I was trying to figure out what happens if you don't have it. Like, it probably doesn't help. Similar differences can be found in unadjusted gray and white matter volumes measured from samples of children selected for exposure to physical abuse, sexual abuse, or witnessing domestic violence. For example, unadjusted data indicating that 4.8 and 5.9 reduction in gray matter and white matter volume in childhood trauma exposed subjects from a demographically matched sample, which is an important factor as poverty is also associated with attenuated cortical gray and white matter development. What? My eyes are burning from the heat. It is so hot, my eyes are burning. It's so hot. Okay, so that means to weaken or reduce force, intensity, effort, or quality. So there was a reduction. And this study also says that it didn't matter if they were orphans or if they had a home and their families were being abusive. The study revealed that it did not matter. Both subjects of the study still had a reduction in white and gray matter, which is so problematic because they need that. This indicates that the cortical loss was proportional to the overall reduction in brain size. However, the reduction was not evenly distributed throughout the cortex and appeared to be primarily prefrontal, as indicated by an increase in prefrontal cortex cerebral fluid. Consequently, several studies... Never mind. There's over 41 studies on this. So there's a lot of answers. Some of these studies date back to like 2001, homie. There's no excuse for why the Department of Social Services runs their offices like they do. We have all of the answers. 2 other portions of the prefrontal cortex were reported to have reduced volume or blow flood in multiple studies. And this, with exposure, this was from exposure to harsh corporal punishment or physical abuse. So studies show that spanking your children actually prevents their brain from growing like it's supposed to, like 6 different parts. You're fucking them up for life. But I already knew this because I've never believed in corporal punishment. This is crazy. Who's hot? So the gray matter is critical for the brain's overall function and is responsible for processing information, controlling muscle movement, and regulating sensory perception. So these things go hand in hand, clearly. I wonder how many, let me Google search one last thing. I wonder how many people claim that have major depressive disorder that they also, how many people with MDD report childhood abuse? I wonder how many of those 21 trauma. I wonder how many of those 21 million people. 37%. That's still huge. 37% of patients report a history of multiple childhood traumas. This indicates a significant prevalence of childhood trauma among individuals with major depressive disorder. And God forbid if they're eating shit food and not getting outside and working out and moving their bodies. These things go hand in hand, and it probably has to do with the way that the brain develops as you're going through this trauma. I mean, it affects the brain in like 6 different ways. It reduces the size of parts of your brains, and some of them get bigger, some of them get smaller. Gray matter and white matter is clearly affected, which is essential for the brain to run properly. It's sad. I really genuinely believe that there is a logical medical reason for why people are struggling so bad. And it has to do with our environments and the ways that we were raised, in my opinion. I think a lot of people still have family. See, for me, I don't have family. Everybody's dead. So I can say these things and process these things out loud, and there's no one to get mad about it or no one to feel some type of way about it. You know, I have the luxury of being able to talk about these things in an open space without offending anyone. Because if my mama was alive, I could never say any of this. It would break her heart. But it's the truth, and it's unfortunate. And maybe the reason that God left me here by myself was so that I could talk about these things and not have to worry about offending anyone or harming anyone with my perspective or opinion. A lot of people don't have that open space to do that, and they struggle alone in silence, and nobody should ever have to do that. It's crazy. I really think that there's a medical explanation for these mental health disorders. I mean, clearly there is. And I'm not saying all people that have major depressive disorder have childhood trauma, but clearly almost 40% admit that they do. And think about all the people that don't even realize that they have this depressive disorder. They haven't come to terms or realized that they had a problem yet, so they can't even scratch the surface on if it came from childhood trauma because they haven't been properly diagnosed. And also, there's a whole other group of people that there's genetic factors that play a part in why they got this disorder. So there's multiple causes for it, but I think that I've been through my bouts of depression, and I wanted to talk about it because A lot of people suffer in silence and they shouldn't have to. It's not anything to be embarrassed about. And matter of fact, I want people to seek treatment, medication, therapy. Some people do well with just therapy. Other people are going to need medication. That's a clinical's decision, you know. But don't suffer in silence. And if you're male and you're struggling, you have a right to be heard, you know. You don't have to stuff your feelings down. You shouldn't have to stuff your feelings down. And matter of fact, the longer you live with blinders on, not acknowledging what you've been through, the harder life is going to be. You have to at least acknowledge, hey, this was fucked up. I wasn't raised right. It was fucked up. You know, sometimes that's all you just need to say is recognize that the abuse or your situation or your environment was not your fault. A lot of people don't even do that. They walk around feeling like, I've met people like that. They walk around with the weight of the world on their shoulders, feeling like it was their fault, and it's not. It's not. You were an innocent child. Regardless if you were 15 or 20 or 2. You know? It's our families and our parents' responsibility to gear us in the right direction and treat us like humans. And some parents just don't even have a baseline of how to do that. And I think it's environmental factors of them, you know, the way they grew up, but also a lack of intelligence. It's crazy that we have these studies and this information and this psychological and medical information is not used. All of the answers are in these 41 reports on how to best gear and raise children and what we need to do for their brains to best develop. And none of this information is used. And this is why we have a broken system. And in my opinion, they're not trying to raise the most healthiest adults. In my opinion. They want to raise, what's the word? They want to raise children that like adapt to what society needs them to be. In my opinion, they raise children to conform. They don't raise children for the best interest of the children, in my opinion. And that's from the education system to the parents. That's just my opinion. But it's really sad. It's really sad. Anybody that's suffering with depression, please get help. You don't have to suffer in silence. It's not your fault. Oh, but I was also going to tell you guys that one of the great things you can do, if you're too ashamed to ask for help, and you shouldn't be, or if you just don't want to and you don't have time, I get that. The best thing you can do is get outside. That's literally one of the best things that you can do for your mental health is get outside. Or I know it's hot right now. It's 90 degrees all over the South. We're literally dying down here in June. Get out early in the morning. Go to the YMCA and ask for a day pass. Do something to get you moving, whether it's walking, whether it's walking your dog, whether it's freaking rock hunting in the mountains, honey. That's literally the best thing you can do. If you're isolating, that's going to make depression worse. Even if you don't have major depressive disorder, clinical depression, and you're just suffering with depression from this economy, from this heat, from these gas prices, from rent, you going through it, the best thing that you can do, seriously, is to get outside. I swear to God. And you'll thank me. You'll thank me. Walk a mile for Jesus, and you'll thank me. I swear to God. I know it sounds crazy. Oh, it's not going to help that much. Yeah, it will. Yeah, it will. It literally pulled me out of my depression last year where, you know, all of that's recorded. You can see how bad off I was. That was depression. Okay? So, mania, depression, PTSD symptoms, I went through it. And I truly believe that if I wouldn't have been forced to live out of a car, I might have fell into a deeper depression and be in a mental hospital right now. It was only because I forced myself to get outside and to get moving that I'm where I am today. And it's took a year to get here, and I'm not perfect. I have things I'm working on and things I need to work on. My life is in complete limbo. It's imploded. But seriously, psychologically and emotionally, I feel the best I've ever felt, which is crazy. It's crazy. I go through my days. Like I said, I've been kind of depressed for the past couple of days, but that was external factors. And I don't know. I truly believe that there is so much health benefits in sunshine. I really do. I just think getting outside is so good for people. And a medical professional is not going to tell you that. That's the crazy part. They make hundreds of thousands of dollars a year, and no doctor will look at you and say, hey, you kind of need to drop 20 pounds. If you drop 20 pounds, your depression might kind of wean off. But that's the truth. Obesity and depression go hand in hand. When I got up to 200 pounds, I was completely ashamed of what I looked like. I knew that I'd put myself in that state, and I was embarrassed to even go walk around the block. I had to fight through it. I started going to Planet Fitness, and I started running outside, and I lost like 30 pounds in no time. And then that turned into 80 pounds after I lived in my car because I didn't have the money for food, but I was also working out because I'm dedicated. But, anyways, get into a state that you're gaining weight, it's going to make you uncomfortable. My clothes didn't fit. I didn't feel like nothing fit on me right. I would go clothes shopping. I posted a video last week of me in like this moo-moo skirt and this floral shirt when I was bigger. And I'm so sick of these problems. Every day, the phone is just a pain in the ass. I want to throw it out the window. Somebody called. Nobody even has this number. So I remember that I was trying on clothes in that video, and I had all these clothes behind me, and not one outfit I felt comfortable in. Not only that, but I had so many like health problems from gaining weight. My arms were always chafed. I always stunk because I sweat more when I was bigger. My thighs were always chafed because I was always sweating because I was big. What is going on right now? I'm so sorry. I think it's spam. So I know how it feels because when I got big, nothing fit. I was sweating all the time. My hair and makeup never even felt like it felt right. I know that sounds crazy, but like when you're bigger, your range of motion is harder. I remember my hair constantly getting on my nerves because I was so big that I could barely turn my neck because I wasn't stretching, I wasn't working out. All I did was eat and drink and watch TV and work. That was it. That was my daily life. Like, watch TV, wake up, watch TV, order DoorDash, get over my hangover, maybe order some more lunch, drive to work, get drunk, work all freaking day, get back home, order more DoorDash, and start the process all over. And I did that when I first got clean in Charlotte. It was 2021. I did that for a full year. I was on hormonal birth control, and I gained 80 pounds in a year. And I remember how uncomfortable I was, how nothing fit, how I sweat all the time, how I was embarrassed to be out in public. Like, not with other people, just myself. I was so big that I felt uncomfortable in my skin. And I knew that it was me that had gotten myself to that state of obesity. And so it was only me that I could blame. That's not the average person, though. In my experience, the average person gets to this state and then they become bitter, and then they become miserable, and then they start taking it out on everybody around them. They have social issues within the family, social issues at work. Most people turn bitter that get to a state of obesity, and they're angry at the world, and they take it out on the world. You can see that in the way that they behave. I didn't do that. I knew it was my fault because I'm rational. I knew that the Jameson, okay, and the Waffle House DoorDash had put my ass into a dilemma. And it was me that chose to eat it, because every time I'd get DoorDash, I'd get this rush of dopamine, and I'd be so happy to go take my food back to my room and sit on my bed, and I'd lay everything out and eat. And then 5 minutes later, after I was done inhaling it like a garbage disposal, I would feel guilt. And I did that for a year. After I first got clean off of heroin 5 years ago, I turned to alcohol. This is very common. I picked up a different substance thinking, because it's legal and millions of people do it every year. But yeah, I got really big, and I remember how nothing fit, how disgusting I felt, how my body dysmorphia got worse. And I was embarrassed. I didn't want to go anywhere. I stopped having friends. I stopped going out. I know how it feels. I've been there. And I was completely disgusted with myself. But the one thing that changed everything was that I knew I had to wait. There was it was like I woke up and I realized that I was at a crossroads in my life. I was either going to continue to get bigger and I would get over 300 pounds, or I was going to turn it around. And so I turned it around. I started walking. It was that simple. I'd go to a park, I'd park the car, I'd cut on some music, and I'd start walking. And then that turned into, damn, I want to run, because I ran in high school. So I was like, damn, I want to run. So I went to the back country and started running the trails. And then I moved into a car. At that point, I think I had a gym membership at Planet Fitness, and I'd been going randomly and doing a lot of cardio. I didn't start out doing any weightlifting or strength training, and I wish I would have. That's why I work so hard now in the gym, because I should have started out with that. For the best results, I would recommend starting off walking and then getting comfortable with certain gym equipment, leg extension, shoulder press, stuff that you can do, 5-10 pounds, and just that, learning that repetitive movement and the way that your muscles fire, you'll lose weight. You will. Doing a little bit of cardio, I'd recommend 3 times a week, probably 30 minutes of cardio, 15 to 20 minutes of weight training. Maybe pick out 5 or 6 machines that you want to try, learn how to use them. Do those for your 3 sessions in a week, and then switch over to other machines, try to use those, and you'll learn, and then you'll get a baseline for what you like, what you feel comfortable with, and also what you're seeing results with and what you want to hone in on. Do you want a bigger butt? Do you want to just lose your gut? Do you want to actually expand your shoulder mass? Like, you know what I mean? And I don't know if I'm saying that word right, but you know what I mean. Walking, just getting outside. It's summertime. Right now is the perfect time to start a fitness journey. The perfect time. If you just simply start walking early in the mornings, right now when it's not too hot, go to your local park, walk a mile or 2. I'm telling you, by the time you get done with a mile, you're going to be motivated to do 2 miles, because the endorphins and dopamine are going to start flowing to your brain. The serotonin is going to flow to your brain. The sunshine is going to start producing vitamin D in your body, and you're going to be motivated. You're going to want to do 2 miles. I promise you. Get outside, enjoy the summer, and hell, by the time the wintertime gets here, you'll have a baseline of physical activity. You can train your body over the summer to simply walk and maybe jog, maybe do some sprints, maybe some jumping jacks, sit-ups, push-ups. Those things are strength training moves that will absolutely work your entire body. Push-ups are great for not only your shoulders, your arms, your back, your core. That one move, just learning how to do a push-up, will be great for your entire body. You don't have to just jump into a gym membership. But if you start out with a little bit of strength training with your own body, push-ups, set-ups, jumping jacks, and then walking and running over the summer for the next few months, when the wintertime gets here, that would be the perfect time to open up a gym membership and get in there and start learning how to use their machines. So you don't have to jump in and be completely dedicated like I am. You can start with baby steps, and that's absolutely how I started. I never envisioned that I would look like I do now, but now that I look like I do now I'm envisioning myself 5 years from now. So I'm grateful that my mother and my father and all of them got me into physical activity when I was a kid. I saw my whole family struggle with their weight. I lost my mother because of health problems, cervical cancer. She was obese. After she did chemo and radiation, she wasn't, but my grandmother died from blood clots, arthritis. I mean, she had an array of health problems from the time that I was born until she died during COVID. My mama, my grandpa, both my grandpas. People in my family had major health issues, but they also drank Pepsi. They also smoked nicotine, which is why I smoke nicotine. I'm going to quit. Everybody had health problems, and it was because of their lifestyle, the food that we ate, the things that we did. We were kind of active. We did a little camping, a little beach trips, but for the most part, when my parents were off of work, they wanted to be on the couch. So we were in the house a lot. I lived a very isolated life. Anytime I was able to play sports, I was really grateful for those experiences, and I'm grateful that my mother, I'm grateful that I saw her struggle with her weight, because if I wouldn't have saw that, I don't think that when I was at that crossroads, 3 years ago when I chose to lose weight, I don't think if I would have saw my mother struggle with her weight during my youth and my teen years, when I was at that crossroads a few years ago, I might have went in the opposite direction towards obesity, which would have led which would have been the worst thing for me, because by the time I'm 50, I'm going to be in the state's care, completely indigent, with no way to take care of myself in a rest home because of health problems. So I never want to lose my physical capabilities to wipe my own ass, you know? And I'm grateful that I saw my parents, my mother and my grandmother, struggle with their weight, because it impacted my life to make me make better choices. Yeah, please get outside this weekend. Get outside this weekend. Do something. Go to the park. It's going to be hot. I know. Get up early on a Sunday and go run a marathon. I'm joking. No, but for real. Get outside this weekend. Get you some sunshine. If you're suffering with depression, I'm telling you, it's the best thing for you. It really is. It really is. I'm not saying that it's going to cure it, but it will aid in you feeling better about life. I see so many people that are so pale nowadays. I know they're not getting outside. I know they're not. I just, God made us to be in the fields, hunting, gathering. Our bodies are designed to thrive on sunlight and physical activity. And without that, we start to deteriorate. For every year that we're not in motion, we lose 3% of our muscle mass. So you take that and you expand that on a larger scale for 30 years of not moving. This explains why people literally start to deteriorate and break down. And I think that if you want to be on this earth for a long time, you're going to have to work hard at yourself, cultivating your lifestyle to have the best possible outcome. I need to quit smoking. I've been all huffy and puffy because I've been smoking like a freight train. This morning I woke up and I was like, what is that noise? It was me. I sounded like a whole damn CPAP machine. I did. I sounded like a CPAP machine. Ain't that what it's called? The mask for people that have, narcolepsy. No. What is it called? Shit. Oh my God, y'all. What is it when they fall asleep and they stop breathing? Hold on. CPAP machine. Yeah, it's something like that. Something like that. I thought it went in the mouth. Maybe that's not what it is. What is it called when people stop breathing in their sleep? Sleep apnea. What's that damn machine? Sleep apnea machine. That's what I sounded like. It sounded like one of them nasal cleaners going. And it was me. I was breathing so heavy. I don't know what it's called. Maybe it is a CPAP. But anyways, I was like, I gotta stop smoking. Y'all, I'm about to head to the gym. I'm gonna charge my fan and we'll talk this afternoon. I need to get some food. I've really been slipping. I haven't eaten today. Can't do nothing about it, homie. I do the best that I can when I can.